For the second degree perineal repair, we're going to use CT1 needles. They're tapered needles, and they're about an inch across. You can use common Vicryl, typically 2.0 or 3.0 for this repair. The first suture, it should be above the vaginal laceration and inserted this way, and this creates hemostasis for the rest of the incision, and you want to tie that up. We'll leave it untied at the moment, but 3 knots, square knots, to anchor that suture would be important. The next suture moves down about 1 centimeter, reaches in and comes up, and these are locking, simple locking sutures, so we want to include that on this simulation. Again, move down 1 centimeter, back from the edge of the laceration about 1/2 centimeter, and take a full bite and pull it through so it locks. The next bite's going to go right into the hymeneal ring, but this one's not going to go through and through. This is a transition stitch. We're going to go through the hymeneal ring and deep into this laceration and come out inside the laceration. So now we're working inside the laceration. So we've transitioned from the vaginal wall to deep inside the perineal muscles. Go straight across and then come out on that red dot. That's the perineal body. These are not locking. Carry it across. And again, this one goes all the way across to the other perineal body and deep into the laceration. This is where you move forward. Move forward, which means in this direction to advance your repair. And you don't have to pull these very tightly or snug them up later. There's always a little edema in the perineal area postpartum, so you don't want these to be overly tight. Go straight across, come up a couple millimeters from the surface of the skin, like that. Now we're going to transition to subcuticular. We've closed most of the laceration. We're going to go straight across, and if you wonder where straight across is, just lay your suture across a couple of millimeters away from the skin surface, go all the way to the apex of the laceration down toward near the rectum, but stay inside. Carry that suture through, and now we're switching to subcuticular. You can grasp the needle in a shorter arc for these and go straight across and upward. This will pull the edges of the skin together nicely. So these are zigzagging their way upward. You notice I have to grasp the needle in alternate ways on this part. And stay close to the skin, or a millimeter or two under the skin. And this will be our final perineal stitch. It comes out right near the perineal body, close to that other stitch. Carry it through. And now we're going to transition back into the vagina. So go right across through that to that perineal stitch, come out the hymen. You're right on the hymeneal line now. Now we're back inside the vagina. Now a final stitch for knot tying. Go directly across, right on the hymeneal ring, and bring the stitch all the way through. And now we have a loop for tying. And it's just a simple tie with 4 knots. This is Vicryl, so one of the knots should be a double knot, double loop. Vicryl tends to untie itself. I won't tie it tight because I'd like to recover this suture for the next student, but that's exactly how we do it.